therefore use muscle testing to work our way into a person's physiology and see what's out of balance. By using these two systems of pulse diagnosis and muscle testing, we have been able to figure out the underlying causes of this autistic spectrum. Let me go over those causes with you now. We can see in the person's pulse and on the muscle testing that this spectrum is being caused by an introduction of toxins to a developing brain and nervous system, either before and during pregnancy or after birth. Where do the toxins come from? There are many toxins that the mother could have taken before she became pregnant with the baby, such as fertility drugs, birth control pills, other chemical residues that are lying in the mother's body that she accumulated over a lifetime of improper eating, taking medications, breathing in pesticides, and air pollution. Also, if the mother took any medications during pregnancy, these toxins could also be influencing the baby. And finally, we find that the high rate of the immunizations that are being given nowadays are way too many for a child's developing nervous system. Within each and every immunization, there are at least 15 chemicals. Mercury used to be included in the shots. They say that they're not included anymore, but now they're substituting aluminum. But even beyond using mercury, whether or not they take it out of the immunization, there are so many other chemicals that are inherent in each and every immunization, and some children receive 81 immunizations by the time they're 6 years old. This is way too much introduction of toxins into a baby's developing brain. Where do the toxins go? They go directly into the baby's brain, because the brain is made of fat and has that capability of storing fat-soluble toxins. They also go into the gut, which is lining the inside of the gut immune system, as we call it, or we could say, as the ancient doctor said, the long channel that begins in the mouth and ends in the rectum, that long tube that carries food. Nature put an immune system inside there with friendly bacteria and which break down food and absorb nutrients directly into the bloodstream, which are then uptaken into the body to make neurotransmitters in the brain. With all these chemicals coming into the baby during pregnancy with the baby and after the baby's born, with all the immunizations, it's destroying the friendly bacteria that resides in that channel or in the gut, which gives a rebounding yeast infection. We all have a little bit of a yeast called Candida albicans that resides in our gut. But the friendly bacteria, or bowel flora as they're sometimes called, prevent this yeast from overgrowing. Once these immunizations destroy the friendly bacteria, a rebound yeast infection will occur. The yeast begins in the gut, migrates out of the gut, causing what is known as leaky gut syndrome, which can give food allergies. And the yeast becomes a systemic yeast infection, meaning that it goes all throughout the body. Once the yeast is in the brain, it gives what is called brain fog, and numerous books have been written on this topic. Not only are the friendly bacteria depleted, but the enzyme system in the gut is also destroyed, which creates intolerance to foods, especially gluten and dairy. It also destroys the lining of the gut, making it difficult for probiotics to implant. Keep in mind that these friendly bacteria absorb nutrients directly into the bloodstream. The blood will uptake those nutrients, as I stated before, and take those nutrients to the brain, and the brain will make neurotransmitters, which will keep the child nice and calm. Therefore, once the healthy bacteria or the friendly bacteria are depleted, and the nutrients are no longer absorbed, the child runs the risk of deficiencies of not only vitamin B12, but numerous nutrients. The answer then isn't to give B12 and injections of vitamins, or to give the child enzymes, or to force oxygen into the child's cells, such as hyperbaric oxygen treatments, because this is going against nature. Let me describe to you the way we do it. First of all, if you give enzymes to a child or anyone, this confuses the